Hello, this is the Maryland Department of Health, and welcome to our Getting Ready for the Maryland Primary Care Program webinar series. Today we're going to talk to you about practice application requirements. In order to apply to participate in the Maryland Primary Care Program, there's a few things that practices need to do in order to be eligible. First, they'll have to pass a basic program integrity screening to make sure that the practice is in good standing with CMS. There's also a requirement for practices to have a minimum of 125 Medicare fee-for-service beneficiaries attributed to their practice. Practices have to use a certified EHR, and because applications are going to be submitted for each individual brick-and-mortar site, the practice must be physically located in the state of Maryland. As part of the application, practices will be required to submit letters of support from their clinical leadership and ownership of the practice, basically indicating their commitment to the program. And practices also have to submit a letter of support from CRISP, confirming that they're working with CRISP and able to exchange data. Beyond those basic eligibility requirements, practices will need to demonstrate that they can meet the basic care requirements for the program as part of their application. For Track 1, this means having experience with certain types of practice transformation activities, like assigning patients to a practice panel, providing 24/7 access, supporting quality improvement activities, and also risk stratifying their patient panel. Also keep in mind that practices will eventually need to move into Track 2 by the beginning of their 4th year in the program, so they're going to need to be able to meet all the care delivery requirements for Track 2 at that point. Specifically, that means that they'll need to have the ability to offer alternative options for care delivery, and they'll also need to have the ability to accept hybrid payment, which is in order to receive the CPCP payment stream, or the Comprehensive Primary Care Payment. There's also a few requirements specific to health IT that are required for participation in the program. Practices have to use a certified electronic health record, and they also have to be able to connect to the state's Health Information Exchange, or CRISP. At the point when they're getting their letter of support from CRISP, they're going to have to commit to effectively using CRISP services and sharing data by the end of their 1st year in Track 2. Quality reporting is also a very important part of this program. As we'll discuss in another presentation, there's 19 measures that practices can choose to report on. So in order to do that, practices need to be using the latest ECQM specs for all measures. And this includes keeping them up to date with annual updates, since the program will be running for several years. And practices also need to be able to report on these measures electronically to CRISP. The data can come either directly from the practice EHRs, or it can be uploaded into the CRISP portal. There's also a few hard exclusions that would keep a practice from being able to participate. First, a practice cannot charge any concierge fees to Medicare beneficiaries. There's also a few other CMMI initiatives in which payments would either duplicate or conflict with primary care program payments. So if you're a participant in one of those models, you would be excluded from participating in MDPCP. These include the ACO investment model, next generation ACOs, and also the comprehensive ESRD care model. Practices would also be excluded if they're a rural health clinic or an FQHC. But one caveat here is that the rural health clinic or FQHC itself is not eligible to participate as a practice site in the program. But if you are a clinician that spends part of your time at an FQHC and part of your time at another primary care location that would qualify, you can participate in MDPCP through the other location, but not through the FQHC. And finally, selection criteria. Once a practice has applied, CMS is going to review applications this fall. They're going to be looking at everything that we just covered, whether or not a practice meets basic eligibility and restriction requirements, whether they have the ability to meet care transformation requirements, and health IT requirements. Selections are going to be made by CMS in the fall, so if you've submitted an application, keep an eye out for a notification letting you know whether or not you've been selected, and also a list of next steps. In the meantime, here are some resources for applying. The request for applications is available at the first link, and once you've reviewed the RFA, you can begin your application in the practice portal. As always, you can get additional updates on our website, and if you have specific questions, you can send an email to marylandmodel@cms.hhs.gov. Thanks for listening.